Good day, ladies and gentlemen, dear friends. My name is Vasily Rakhoi. I am a hand transplant patient from Innsbruck, Austria, and the founder of the Voice of VCR Patients. Welcome to the interview. Today we will meet Mrs. Sylwia Nowakowska Gretarsson, whose experience sheds a light in a side of VCA we rarely hear about. While VCA reports tell us about modern technology, groundbreaking procedures, we sometimes forget those who silently walk beside us, our family members, our volunteer caregivers. Today we are going to talk about resilience, invisible labor, quiet strengths, and love. Let's begin. Good day, Sylwia. Nice to see you.
Hi.
Sylwia, before we dive into the story, tell our viewers, please, about yourself. What matters to you in life before you met your husband, before the story before the head transplantation, so to say?
Okay, so my name is Sylwia. I am originally from Poland, and as a profession, I am a yoga instructor. And so through my profession kind of might reflect one of the things that matter to me the most, which is well-being. And that's probably why I step onto that path, the path of being a seeker of peace, a seeker of something that I would define as a sustainable happiness, the one that comes from within and not from the outside.
Understand. Yeah. Sylwia, my first question would be, of course, about your first meeting with Felix. How did you meet him? And it would be very interesting to know for our viewers, did Felix injuries embarrass you or scare you? And what drew you to him? His strong character, sense of humor, or something else? Could you tell about that, please?
So we met in a networking event for English speakers. So he was not fluent in English. Sorry, in French. He was not fluent in French. And for me, it was just a beginning in a new city. And I always like international environment. So because I just arrived to a new city, I was quite socially active in events around different cultures and foreigners in Lyon, where we met. And so yeah, it's a little bit interesting because when I met him, I feel like I didn't maybe I kind of surprised myself because I consider myself as someone who is shy, but it was me who went towards him because obviously he stood out with his prosthesis. At that time he had prosthesis, and on one of the prostheses he had a metal hook. So it sparked my curiosity, and so I went to approach him. And so probably what made me drawn to him was his positive attitude, which I think my surprise from coming from someone in this level of handicap, and he came across as someone very positive with a huge sense of humor. And sometimes I question myself, and I said to myself, this guy, he seems happier than me. And there is this big difference from basic point of view. I have everything because I have a whole body. He doesn't, but still he seems stronger in his mind. He seems more emotionally stable, more happy, more positive. And so I looked at him as some kind of a role model, someone to look up to, because he was a good example of, it's easy to be well balanced and happy when we have everything, but when you don't have two arms, that's another story. So I was I was really impressed. Yeah, I was impressed about that.
And did you know at the beginning about his dream to undergo the hand transplantation? And Sylwia, what was your reaction? How did you see that as a necessary risk, as a realistic plan? Because of immunosuppression, you know, it's very dangerous for patient's life. Or did you support him and believe it in success of the surgery?
Um, I think because this story is pretty unique. Most people,
Mm-hmm.
even today, when we evoke arm transplant, most people misunderstand and they think about artificial arms. So of course, when I heard arm transplant, it was something exotic, and I was impressed. I was impressed by his determination and how he turned his life around in order to focus, like his main focus was operation, like his life was just about this. And I think it is impressive to see this level of motivation and determination. And because I didn't have any knowledge, any experience in the topic, it was hard for me to think in terms of, is it something that is going to happen? Is it something that is not going to happen? But of course, with years, as we started our life together, and I saw that not much was happening, the process was very, very slow.
Yeah, yeah.
I think most of the time, deep inside, I didn't believe that it would happen.
Mm-hmm.
But of course, I understood also very quickly that for him this project was non-negotiable, and even I didn't like certain aspect of this project, such as the idea that the operation would make him less capable and more handicapped for certain time. I didn't like this idea at all, but when you have a loved one and you see how important it is for them, you kind of adapt, it's like I didn't have it in me to try to dissuade him, because he started this journey before he met me, and
Mm-hmm.
he did so much, like he moved to a different country. He kind of turned his life upside down for this, so I would not dare try to dissuade him from this. But to be honest, I didn't believe in this project. When I saw that, yeah, it was already a few years and not much was happening, but I wasn't expressing it because of course it's not nice to, it's not nice to share a lack of hope to someone who is so passionate about this
Yeah.
and who has this strong desire. But yeah, I didn't believe that this would happen.
But you discussed it, the issue of immunosuppression. Maybe you said to him, Felix, it will make your life shorter, and maybe it is we can stay together without this transplantation.
Well, he was already on the immunosuppressant,
Mm-hmm.
so this was not a concern. But for sure, maybe the aspect that I didn't like, and maybe something that I wanted to change, was that in this kind of transplant, we are very limited geographically, because the recipient can come from a short geographical area around you. So this meant that we were limited in our traveling. For example, my family is in Poland,
Mm-hmm.
and I became his primary caregiver. And
Mm-hmm.
because of this process of waiting, I was limited in traveling. Like, I didn't have this freedom, because every traveling would mean a risk of losing a potential donor. So
Yeah.
yeah, that was
Mm-hmm.
probably the most, I could say, annoying part of it, because
Yes, it took 5 or 6 years, as far as I know. I mean, the waiting on the being of the waiting list.
yes. So In the summertime, I don't remember if it was the whole summer, but or maybe just 1 month, he was officially off the list because the doctors go on holiday. But otherwise, all year on the list, and we just can't. We don't have this freedom to travel. We were limited, and that was sometimes frustrating. Yeah.
Yes, yeah, you're right. Sylwia, how do you think, did you need a special preparation for being, so to say, the wife of a hand transplant patient? Maybe you would like to meet, or did you meet the family members of other hand transplant patients? Would it be helpful for you in that time, in that waiting time?
Well, for me, I didn't think of any preparation
Mm-hmm.
because being with someone who is handicapped is already in itself a big life challenge, and it's not something that someone prepared me for. And
Mm-hmm.
so when you experience something like this, it's like you already build in you some kind of a resilience muscle, you know. But these are the things that you learn as you go, because I didn't get any training to be a wife of a handicapped person, and the same with and also because he was kind of the first one to have this kind of operation, we couldn't really know the feedback of other people. It's you know, it was such a new thing, so yeah, it's hard to prepare for it.
Yes. Mm-hmm. But
But
if you had some learning materials that could help you to prepare yourself emotionally, practically, I don't know, psychologically for this transplantation, would it be helpful for you? How do you think?
um, I think it depends on each and everyone, because I think I gained some kind of resilience from being with him. But
Mm-hmm.
for sure, what after a time, what I wish I had was some kind of a support during his time of hospitalization, because
Mm-hmm.
in our country, um, I don't know if it's not something that they offer or if they don't think about it, but it's true that it is a huge transition, and I didn't have any support. Uh,
Mm-hmm.
maybe I would appreciate having some therapy sessions, you know, with
Mm-hmm.
specialists during the time,
Mm-hmm.
because I think that for each and everyone, the process of healing will be different. For example, with Felix, what I remember now was difficult was that he was taking so much medicine, and this medicine, it changes you, you know,
Mm-hmm.
just changes you. Like he was different version of himself, maybe not the best one, because the pain was dominating. The pain was just so present that there is just no room for maybe, you know, for something else like compassion, or you know. And sometimes as a close one, you might think like, oh, he's maybe being a little bit cold or maybe different, but there is pain, and there is no room for anything else. And maybe I wish during this process of hospitalization I had some support, you know, because
Mm-hmm.
like to prepare before, yeah, maybe now as I see how it is,
Mm-hmm.
it would be good
Mm-hmm.
if the team knows exactly how it's happening, you know. But
Mm-hmm.
yeah, for sure. To answer your question shortly, I think that of course it could help, because we are kind of being thrown in a deep water, and
Mm-hmm.
you have to do it all by yourself. And also, of course, as a patient, he gets the most attention because
Mm-hmm.
he's in the suffering, and of course, but I think uh, if the partner is not strong enough, the relationship could be at risk, because it is challenging, like for me, for example, you are going from being in a relationship where you're very close, like soulmates and stuff, and then you don't get any attention, any affection, because there's just pain and nothing else, and so much medicine to deal with this pain, and you are just not in the headspace to offer something to the other person, so these things are difficult for sure, because when you don't understand, you might question yourself, like, who is this person? How is it going to be later, but excruciating pain, it does make you different.
Sylwia, you have already started answering my next question, about first 3, 4, maybe 5 months after the surgery. There are fear, stress, not only for patient, his doctors, nurses, but also for his loved ones. They have to stay, supportive, patient, and strong. Sylwia, what would you say to other wives and husbands who has just started this journey or are already on it? What would you advise him? What could help them to go through all these challenges you have already mentioned?
I think the most basic thing would be a self-care, to take care of yourself, because when you take care of yourself, it's like you fill up your cup and you can face the challenges from a position that you are stronger, but if you are depleted from the fatigue, from the emotional changes, and you are just depleted more and more and more, it's hard. It's like you're weak to face the challenges, so the self-care, for sure, the self-care is very important, and this is different for everyone. For me, I'm lucky to have 3 dogs, because they make me go on walks every day. So every day I would have time that I go on a walk with my dogs, and usually it's in the woods, usually it's in the nature, and these things are really important. And sometimes people might not think about it, but we have to take care of ourselves, because that's the challenge with caregivers, and that was also for a certain time my challenge, because we tend to give a lot, but if we want to keep on giving, we have to fill our cup on a regular basis, and this has to be non-negotiable. So just basic things: take care of the sleep, eat well, and practice sport, because physical activity releases endorphins and helps us feel good. And I think physical activity could really help, and this can be different for everyone, but in general, movement, for sure, it can help. And also probably relationships, because probably the worst thing would be to isolate yourself, to not have people to share. I was lucky to we have strong family on both sides, on my family in Poland and his family from Iceland, and these are strong relationships. And so of course we share this, and we were in this together, and also like visiting in the hospital sometimes, we can swap, so it's not just one person doing everything, because it's hard sometimes, because there are also certain aspects, like, for example, I don't know how it is in other countries, but in France, in the hospital, the food is really not good. The food is bad, and so of course, to help the patient, we sometimes have tendency to bring good food because you don't have much when you are stuck in bed and you are in excruciating pain. At least have some pleasure through the food, and also it is important in the healing process to eat well.
You're absolutely right. Absolutely right. I have the same experience.
Yeah.
Thank you for this advice.
And of course, it's important because unfortunately in France, like if you look at the food that they serve you most of the time, you might think, are there any nutritional values in this food? Like, is there anything? Are there any vitamins? And of course, when your body took such a huge load, you need good quality food. And so, of course, it's the family who can provide this. So of course, if there is more than one person, if the family is strong, it's easier because then it's not just on one person, you know, because of course there will always be the partner is the closest person, and sometimes we might need to have a break and just take some time for ourselves, even if it's just a weekend or something. So it's good if there are other people who can step in, because yeah, it's important to have this attitude of like it's not all on me, you know, because people want to help usually, but we have to also be able to express our needs, you know.
So to say, you have to be strong, yeah, to help the others, yeah. And the family support, yeah, it's very important. It's too much for one person to help, so to support the hand transplant patient, yes, and you need the family support. Sylwia, and we have started talking about the family. And what was your family reaction as they learned that your husband was going to undergo the hand transplantation? Did they accept, so to say, his wish or his decision, or were they against his decision, or how it was?
Well, I think in my situation for parents, the most difficult thing to accept is that their daughter goes into relationship with an armless man, you know. So after accepting something like this, I think they can accept anything, you know, because of course it's difficult for parents to see that their daughter chooses a man who is not physically whole, because of course that comes with challenges, and I think most of parents would want to spare their daughters you know, this kind of challenge. So after this everything else, I think it's like, you know, it's nothing. And the thing is, because this is such an unknown thing, people don't imagine, you know. I think it's often also met with this enthusiasm and excitement because nobody is really aware of the difficulty. And also, what I have personally experienced, so it was because, of course, we don't always talk about this. There is operation, and then after there can be complications, you know, things like this. And we faced severe complications in 2023. And what I have experienced, it was a very good lesson for me because so we shared the hardships with the family. We told them what was happening, the rejection. He was in the hospital, and so the family in Iceland, they were really scared. And what I experienced is that I absorbed their fear, you know, and this was really, really bad for me because I realized that I have to be strong and I have to be a rock, and I have to keep faith. And if I am surrounded by worry and people panicking and it affects me, it's really bad, you know, because I'm not in a position, because what we are doing, this is such a it's really it's tough, you know, and you have to be strong. So this experience, the lesson from this experience was for me that when we had new difficulties, we stopped telling family because they worry too much. And the thing is, we are in the unknown. So for me, this multiplying worry and worrying together, it's really bad. It's really bad because, you know, like other people, they affect you. And if you, some people are easier to affect, others people less. But my experience was if I receive a lot of worry from other people, it affects me and I just can't do it because I have to be strong for Felix. I have to, you know, be this rock for us. And so for me, it's non-negotiable to worrying is not an option for me. And that's the choice I made because if we start worrying, we are just sinking, you know. So that was the choice that we made, that we are not sharing everything because, you know, people are imagining the wars, they are projecting the wars, and it doesn't always help, you know. But it starts calling you and like imagining the wars and just going in this negative scenario when we don't know anything. We are in some critical situation. We are trying to survive. I can't handle and I can't be busy reassuring other people when I'm not a doctor. I don't know. We are just in a survival mode, you know.
Yes, this is very, very useful experience, Sylwia. Thank you very much. Sylwia, and did the reality of the hand transplantation, you have partially answered my question, my next question. Did the reality of the hand transplantation meet your expectation? Did it turn out harder than you thought? Or easier, but after that, yeah, it is not shown. It is not, I understand. It was harder than you thought. Am I right?
The thing is, I didn't know what to expect, and in our situation is different because I met Felix without arms, so that means that I accepted him without arms. So I didn't need him. I didn't to have arms. I didn't have those expectations. But for sure, what I can say is that the result is just amazing, and so to give you an example, as his primary caregiver before he had his operation, I wouldn't leave him alone at home for 24 hours because he needed assistance with feeding and with many, many things. And since the operation, I traveled for work a few times, and the longest I went to visit my family was for 5 days. And this is just amazing, you know. This is just, you know, to go from not being able to leave him for 24 hours to be able to leave him for almost 1 week. It's huge. Because, so of course, for me to have this freedom to leave him and to live my life and you know professionally it's also important. It's good for me, and I'm sure for him, for his self-confidence is also great because for patients like him, it's always difficult to accept that he might be some kind of a load on other people, you know. It's not good for your self-esteem, for your consciousness. It's hard. So having this freedom, it feels amazing for him, and it's great for me because for sure it's not easy to be a caregiver. You know, we are our freedom is a little bit limited.
Yes.
And so, of course, this operation comes at a huge cost because there were a lot of complications and the medicine is so strong. but I think it's still worth it because even though these arms will probably not last his whole life, that's the realistic predictions. It might give him, let's say, maybe 10, 15, or even 20 years of a better quality of life, which is great because so now he can do a lot around the home, and for sure for him it feels great, and it also makes my list of things to do smaller because
Mhm.
he can now garden. He can do a lot of gardening, use lawnmower, the high pressure cleaner. All these things they were not available, and so you kind of go from feeling useless to being a big contributor in the household. So
Mhm.
for sure it's worth it, because
Mhm.
yeah,
Yeah, this is a very good example with free dogs.
yes.
Of course, it is very complicated even for for a healthy, so to say, man to provide for food for free dogs for yourself. So to say, Syria, can you say that this surgery changed Felix and your life for the better? So to say, it changed for better Felix self esteem, your relationship, as you mentioned, household. Yes, it's very important for every family. Can we say that this surgery changed your and Felix life for the better?
Yes, yes, for sure. But I think what is very important to share is that we are never free from risk of complications.
Yeah.
And we did face those complications already. And these complications, they can be very tough because when we had these moments of complications that were quite long, honestly, I was a little bit like, I don't like these arms. Why did we do it? Because when all of a sudden those complications, when they last, and you are just hospitalized all the time, and you lose autonomy, and I have to be much more present, and there is so much complications in these moments. Sometimes you might resent those arms, like, why did we do this,
Mm-hmm.
it's costing your health, because in 2023 he almost died. The doctor said we almost lost him. And
Mm-hmm.
so, it's important to know that you are not free from this risk, that
The price is too high, or how
yeah,
would you say?
the price is extremely high. And I think people have to be, the best way to be equipped to face this is to have a strong relationship. For sure, you can't do this by yourself. That's for sure. You just can't, So to have a strong relationship, to have great relationships, because of course friends, everyone counts. If you are a good person and take care of your relationships, you have many people around you, many people who are available to help you, to support you, both physically and also as a mental support.
Mm-hmm.
So for sure, and then also our situation is a little bit unique because so Felix was already on immunosuppressive medicine, which made him a great patient to receive this transplant. And the other great factor is that I don't have kids, which makes me more available, and
Mm-hmm.
I can imagine that if a partner would go through this, having small children and have this on the top, for sure it can be difficult, but it's not impossible, of course. And I think, yeah, like, having good relationships, it does help, because yeah, because then you just have an army of people who are there for you. So this is something I think to keep in mind, just for anyone in any situation. If you are a decent person and you take care of friendships, your life will be easier, because we never know what happens to us and when we might need help. But if you are not a nice person, you might not. You might end up alone in the situation when you really need help, you know.
Sylwia, you have already partially answered my next question, but I think it is a key one for our conversation. Therefore, let me ask you directly. What is it like to be the wife of the hand transplant patient? Someone who provides not only emotional, physical, and psychological support, but also faces work related issues, financial problems, bureaucracy. Someone like you who have to handle on this problem on yourself.
I think as for the bureaucracy and financial part, for sure, it might be different depending on the country we come from, because Felix receives his handicap pension from Iceland, which is very favorable for us, because Iceland is a very expensive country, and then we live in France where the life is much cheaper. So this pension for us, it is possible to survive on this pension in a situation where, for example, like it was with us, I have to put my work a little bit on the side to make myself available. But this is not possible for everyone, because in some countries, handicap pension is not enough to survive. It doesn't cover. So yeah, this. But of course, once again, if we are a decent person and we have a lot of friends and good relationship with family, they are always there to help us, and that also can be used in this kind of situations. Same to answer the question regarding bureaucracy, it depends on the country. For sure, France is a country where these kind of things are not very smooth, and it's the process is very slow. And for that reason, it took us a very long time to just be on the list, you know. So this part, it so much depends when a person live, when they are where they are based. But for sure, I would say it was for me a gift to go through this, because witnessing something that is so extraordinary, such an achievement, and also to see, so the doctor's hopes were much 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 smaller compared to the result that he enjoys now, which we can't really say the end result, because some say that it might continue for a little bit longer. So we can't even say that the result is finished. You know, it can still progress. And to go with someone through such a challenge and such a huge accomplishment, it's a very interesting adventure, and it's an adventure that might open some doors. Like, for example, when we met in Greece, we were invited to this transplant congress, and we met people with amazing stories. I remember I was deeply touched by some of the stories, because once again, like, in each country is different. I remember the story of Lisa, whose son passed and gave many people the organs, and she is in touch with the recipients. This is something that in France it wouldn't be possible, because here it's anonymous, you know. So so it's different experience, and I find it extremely interesting to be part of this, to know these life stories that people have, because it's not a common thing to meet VAC patients. We talk with other people. Everyone heard of organ donors, but they don't so much imagine VCA transplants. So to be part of it, it's for sure something that makes your life richer. It's to see to witness these miracles of the medicine, the science, and to see this transition from a man who was extremely limited to a man who now can ride a bicycle and spend all day doing gardening. It's beautiful, you know. And for sure, it can, as a partner, it makes your life richer in a way. Like, you know, we often take our body for granted, especially I find in Western countries, which are privileged countries. Sometimes we are like blind. We are not grateful. We don't appreciate many things because life is so good, so comfortable. We have everything. And so to be part of this story of someone who goes from not having arms to then have arms, still very limited, but to see, you know, this transformation, this joy, this success, this accomplishment, it makes you, it can improve your life in a way that your perception changes. You can maybe go from this person who is ungrateful, who is blind on the gifts of life, to see life differently, you know, because I think that it can help everyone to see life as a gift and to see our wholeness as a gift.
Yeah, thank you, Sylwia. Thank you. This is an excellent reply. Yeah, many thanks. Sylwia, at the end of our conversation, I would like to ask you one more question. It's very interesting for me too. Did you learn, Felix, to practice yoga? It's quite interesting. Did making that with you or?
Yes, yes, of course, and once again, that is another example of how meeting him made my life richer. Because when I met him without arms, he asked me this question: "Can I do yoga?" And I wanted to say yes, but in the back of my head, I knew that I didn't really have tools for it. And so meeting him made me learn then a type of yoga that is much more suitable for people with limitations. And so meeting him kind of directed my my path as a yoga teacher, you know, because today I specialize in a type of yoga that is very suitable for people with limits. Because you know, I met this person who became the you know, one of the most important people in my life, or the most important person in my life, who was limited, who expressed the desire to do yoga, and I didn't feel comfortable thinking that this activity was not available. And so from this, the desire of creating something inclusive and not exclusive was born. So it was thanks to him that then I chose a certain path. And so yes, he to answer your question, he's doing yoga with me. He's participating in my classes. Yeah.
Great, great. I have never heard about any hand transplant patient doing yoga or practicing yoga. It's very interesting. Yeah. Thank you, Sylwia, for your open and honest talk and for your time, for supporting our patient initiative with your story. I wish you and your husband a lot of strength and, of course, success and health. And I hope your dreams will come true and everything will be fine.
Thank you. And Vasily, thank you for what you're doing, because I think that this part, what you're offering now, it's extremely valuable because, of course, one of the frustration for Felix was to not have access to the experiences of the receivers. And so, yeah, I wanted to acknowledge you for that, because this is extremely valuable, and you took this role of providing these valuable experiences. So really, thank you for that.
Thank you, Sylwia. It's very nice of you. Yeah, I wish you a fine day and best wishes to Felix. And I hope to meet you once again, maybe in Greece once again.
Thank you. Thank you so
Thank
much.
you.
Take care. Bye.
Thank you. Have a nice day, Sylwia.
Bye.
Goodbye. Bye.